Okay, today Brad and I are going to show you how the hang and twist might help your back pain.
This is not the peppermint twist.
And it's not the twist and shout.
Okay.
Okay, first off, I want to say, Brad, that we like the hanging handles because it allows you to keep your back flat against the wall. However, if you don't have hanging handles, you have a pull-up bar or a rafter, we can have you first try that
Right.
to see if the decompression helps your back pain.
Right.
So basically, what we're trying to do is lengthen the spine. So if you take your end, Brad,
Oh, yeah.
and I take my end, and
So here's the head, and
Right.
so the hanging up. You're hanging up here, and I'm going to support the upper back,
Right.
as it like my arms do.
the weight of his legs will actually pull a bit and hopefully separate the vertebrae just minutely.
Right. We're just decompressing it just enough to get some more circulation and imbibition, perhaps even.
So
Bob.
yeah,
This is what we're talking about against the wall, or if you have a pull-up bar, you have to be able to grab the handles and still have no force to your back.
right.
Because you want to go slowly, you can see I'm bending my knees, slowly putting traction or force the decompression through my spine.
Relaxing the abdomen.
Yep,
You know,
yep, right there. And that can be a little difficult for
it
some
brings
people.
us the first rule, Brad. No pain.
Yeah.
Absolutely no pain. Should feel better.
Yeah, and right now mine feels better. So the wall actually acts as a little friction and a reminder to keep straight. And if you're touching with your butt and your shoulders, you know, in your head, you know your spine is neutral. And I'm going to rotate this way.
Just to the right.
Yep. And if ow, that hurts, then I'm not doing that anymore.
That's right.
Just put a stool in front of you. This one happens to have 2 levels, which is very handy. I'm going to go down to this level.
Again, that's where the wall comes in handy.
Yep. Now, if I do push my butt to the wall, it extends my back, and after a while, it's not comfortable. But if I go the other direction and I do this, it actually flexes the lumbar spine. That feels better. And actually, for me, this even feels better yet. So
Sure.
when I do this at home, I do bring my back forward like this. I don't always use a stool because I don't need quite that much a lot of times, the way it's set up in my basement. I don't need that, but oh, it feels really good now.
So this might give you relief for 20 minutes and will allow you to walk, which you normally can't because you have too much pain.
Right.